So I've said this to a lot of patients actually, and it's sometimes to my own detriment. But I think that with nearly all healthcare providers, physio, chiro, osteo, exercise physiology, massage therapy, and then the other end, surgeon, they're all interventional. So I have a vested interest in somebody doing functional exercises to improve their mechanics. And so when somebody comes in and sees me, it's in my best interest to have them come back and see me again for more exercise and guided, right?
Yep.
And so something that I often talk to the patients about is, and a huge benefit of sports and exercise physicians, is that there isn't a come back in a week, come back in a week, come back in a week approach. And it's not just black or white, yes, I'm going to cut you open, or no, I'm not going to cut you open, and go back to what you're doing. It's more of a roadmap. It's going, well, I don't have a vested interest. You can choose to listen to this information that I'm giving you based on what I've seen, or you can choose not to. But it's coming from a level of expertise that really helps them make better decisions.
I guess we maybe come from that slightly more holistic stand back approach and look at someone. I know I'd like to think that's how I treat my patients, and I think we definitely do that at North Sydney Sports Medicine. It is looking at patients as a whole. What is it that you want to achieve? What is it that you want to do or get back to doing? What is restricting you currently, and what is the best path for that? So it may be that you have, for example, a bit of wear or damage, whatever word you want to use, through your knee, but you're a religious soccer player and you're in your 50s, and we know that if you continue to go super hard on that knee, you're potentially progressing that issue further. However, you also have to weigh up, well, what are the benefits of you playing sport, and the socialisation and the mental well-being and all of that side of things that come with playing your soccer, and if you truly understand the potential issues related to your knee, but you want to continue to play, then okay, fine, we'll educate you around that as long as you make that educated decision. And then how can we optimise how you move and how much of what you do to allow you to play soccer but not overload things unnecessarily. And I guess that's sort of roundabout way, but that's that more holistic approach. So we're not necessarily going to say, no, you definitely can't play. Sometimes we might, because it's not in your best interest. But it's looking at you as a person in a holistic manner, and making you as functional, as pain-free, and as strong and as mobile as possible within a patient's kind of understanding and desire of what they want done.
Yeah, right. Well, I mean, I think from my experience of receiving referrals from lots of different practitioners, sports physicians, from the medical side of it, the sports physicians tend to have the most comprehensive understanding coming back of actual functional limitations. So I'll often get stuff, if it's a shoulder, there'll be information provided back to us about whether their scapular control is adequate, whether they over-recruiting particular areas, or knee in our way, it could be related to their pelvic control, or their, so it's not just get stronger, go back. It tends to be a much more...
It's how you move and how you move what you want to do, and optimising that.
Yeah, right. That's a really clear difference, I think, from receiving referrals. That's a real point of difference with exercise physicians to getting a GP referral, for instance, or even getting a surgical referral. Post-surgical, you often get referrals where there's a protocol involved.
Yeah.
But if they're not coming in for surgery, and someone presents to the surgeon and the surgeon says, you're not ready for a replacement yet, just go and get stronger. Sometimes they'll refer them back to exercise physiology, and it's just get stronger. It's not any really specifics around what might be causing them to irritate their knees along the way, but that's definitely a point of difference for you guys.
Yep, 100%.